medical gaslighting when patients feel their doctors dismiss their health concerns. Studies show that women and people of color are impacted most, and the results can be devastating. As a story we first saw in the New York Times, and Janae is back with more on that. Good morning again.
Good morning to all of you. So that term medical gaslighting, that's a new one that we're hearing, describing when doctors or medical providers downplay, dismiss, or even criticize a patient's concerns, leading to misdiagnosis or delayed diagnosis. And we spoke with a woman, a nurse herself, who shares how that impacted her health and her life. Despite 2 congenital heart conditions, nurse Jenna Reish loves to run.
I was probably usually doing anywhere between like 40 miles a week or so. And yeah, it was just a huge part of my life.
So when the 35-year-old started to struggle on her jogs, Jenna says she sought help from numerous doctors, several of which she says dismissed her symptoms.
I actually had one of the doctors say that for a nurse, I seem to have a really difficult time explaining my symptoms. And I was so insulted by that, because if there's anything I pride myself in, it's the fact that I can explain my symptoms really, really well.
A new doctor who did extensive tests found she needed heart surgery, which Jenna says saved her life.
Every run I went on could have quite literally been the thing that ended my life, and that is so scary to think about.
Medical gaslighting is the term used by some patients who say their symptoms are inappropriately dismissed as minor or dismissed as psychological. Up to 12 million Americans are estimated to be misdiagnosed every year.
Unfortunately, women and people of color are more likely to experience gaslighting from those who are supposed to care for them. And some patients begin to accept this mistreatment as the norm, and some distrust the healthcare system as a whole, and then are less likely to even seek care when they need it.
On average, some studies suggest women are less likely to receive the care they need, like less likely to get basic tests for a heart attack. Multiple factors could contribute to differences in healthcare among people of color, including unequal access to healthcare and potential biases among medical providers.
If someone views a patient as of a lower class, or that they will not follow up, based on their race, this can then influence what they then do for that patient. They may be less likely to prescribe a certain medication for them or refer them to a specialist.
What makes you want to speak out about this now?
I feel like it's my purpose to do this. If you are a patient and you feel like you're not being heard or you're being disregarded, that you deserve to seek a second opinion. You deserve to get the care that you need.
And so Jenna told me that she would take her husband to every appointment because she noticed that she was taken more seriously when he was with her. Now remember, she's a nurse and has been for over a decade. Her husband, Robin, is a software developer.
Oh my goodness. Janae, thank you. Our chief medical correspondent, Jen Ashton, is here with this. And are you just shaking?
Yeah, we're just shaking our heads.
I know. What can... If you think your physician is not taking your symptoms seriously, what should you do?
Well, first, I think we have to start with the assumption that any physician actually wants to do the best by the patient. So this unfortunately does happen, but it's not the norm, number one. But I think there are some basic tips for people. If you think you're not being heard or not being taken seriously, number one, always trust your gut, trust your intuition. No one knows your body better than you do. Always consider a second and sometimes a third opinion. That is your right. You will never insult a reputable physician by asking for one. And then, of course, you do want to check out the logistics of your insurance plan, because unfortunately the devil is in the details, and sometimes that may or may not be covered. But we never want to hear a situation where finances gets in the way of getting the right clinical treatment.
That is true. I'm glad you brought up about, a good doctor is not going to mind you asking for a second or third. Never.
No.
Is there something that we can do as patients even before we get into that position?
Well, I think the first thing is to recognize that medicine is not robotic. It's not cookie cutter. There actually is a lot that goes on into making the right clinical assessment and making a diagnosis, but then some roadmap, if you will, to being an empowered patient. I think you want to always share share any and all details about your symptoms, even if you don't think they're pertinent or relevant. You, of course, want to provide as complete a medical and family history as you can. Never be afraid to ask questions. And like we heard in Janae's piece, it always helps to bring someone there with you, another set of eyes, another set of ears.
That's right. Thank you for being our set of eyes and ears.
That's right.
Appreciate that, Jen. Now let's get back over to Sam.